Yeah, so that's a talk in a session which is about the microenvironment in CLL, which is a big topic over the past few years because the microenvironment, we realized, is playing a big role for growth of these leukemia cells. The cells, if you isolate them from the patients, they don't really grow, but if you put them with support feeder cells, then they start surviving and growing. So from preclinical studies, we know the microenvironment is very important, and it has become a very hot topic with the introduction of the new agents which are interfering with this interaction between the microenvironment and the leukemia cells, which are these kinase inhibitors that block, for example, BTK or PR3 kinases or spleen tyrosine kinase. Those are kinases which are essential for interaction between the microenvironment and CLL cells. And they are so successful now in CLL therapy that they started replacing more conventional type of treatment in many patients now. So in terms of biology, it's very interesting. If we block interactions between leukemia cells and the microenvironment, then the cells get mobilized. They traffic out of the microenvironment and go into circulation. When we start treating patients with these new agents, the leukemia cell counts actually initially go up because the cells are being mobilized out. And that's a part of this particular and interesting activity of these new agents. And it's maybe one of the main activities. So what happens is when the cells get displaced and mobilized from the microenvironment into the circulation, they're kind of trapped there, and they basically leave their home where they grow in the tissues. And if they leave their home and are trapped in the circulation, they miss basically the essential growth and survival factors. They are deprived from these factors and then undergo apoptosis. So it's kind of a state of homelessness to these cancer cells that is induced by these new agents. So I'm going to highlight that, and I'm going to connect that to the question, well, what are the factors that leukemia cells use to migrate to traffic from tissues to blood back and forth? And the factors they are using are so-called chemokine receptors and adhesion molecules. So I'm going to talk about the key molecules and how the function of these molecules is affected by the new agents, by BTK inhibitors, PR3 kinase, and SYK inhibitors, which are now so successful and have kind of revolutionized the treatment of CLL.